Hello everyone, welcome back to my channel. In this session, I am continuing with the topic scalp. So those who haven't seen the scalp part 1, please do watch that so that you will get a continuation for this session. So in this session, I'll be discussing about the blood supply, the nerve supply and little bit of lymphatics. So first we will start with the blood supply. So when we talk about the blood supply of scalp, it is very rich in blood vessels, and that is the reason why when we get a cut in the scalp, there will be profuse bleeding because in the last session I have already mentioned that the blood vessels are actually adhered to the fibrous tissue and they fail to contract on its own whenever there is an injury. Now let's see what are the blood vessels supplying the scalp. So when we talk about or when we think about the supply of scalp, it comes indirectly from the internal carotid artery and sometimes directly from the external carotid artery. So these are the two arteries, the internal carotid artery and external carotid artery, which are supplying the scalp. Let's have the auricle as a demarcating plane. So how many arteries supply the scalp in front of the auricle and how many arteries supply the scalp behind the auricle? So in front of the auricle you have 3 arteries and behind the auricle you have 2 arteries. So altogether 5 arteries supply the scalp, and out of which you have the first and second, that is supratrochlear and supraorbital. They are actually indirect branch of internal carotid artery, that is they are branches of ophthalmic artery which are branches of internal carotid artery. Whereas the next artery, superficial temporal artery, it is the terminal branch of the external carotid artery. Then behind the auricle you have 2, that is posterior auricular and occipital artery. They are the branches of external carotid artery. So 2 branches, indirect branches from the internal carotid artery and 3 branches from the external carotid artery. And we can see that in front of the auricle you have supratrochlear, supraorbital and superficial temporal, and behind the auricle you have posterior auricular and occipital. So that's about the arteries supplying the scalp. So when we discuss about the arteries, we have to discuss about the veins as well. So the veins are actually the corresponding veins, and you have 2 other sets of veins. So let's see one by one. First we will discuss about the veins corresponding to the supratrochlear and supraorbital arteries. So which are the veins? You have the supratrochlear and supraorbital veins. They together form the angular vein. So here we can see that this is the supraorbital vein and supratrochlear vein. Together they form the angular vein at the medial canthus of the eye, and from there it continues down obliquely as the facial vein. So that is about the supratrochlear and supraorbital vein. Now comes the superficial temporal vein. So what happens to the superficial temporal vein? So superficial temporal vein actually joins with the maxillary vein, which is the corresponding vein of the terminal branch, the other terminal branch, the maxillary artery. So superficial temporal vein joins with the maxillary vein together to form the retromandibular vein within the parotid gland. And this retromandibular vein has got 2 divisions. One is the anterior division and the other one is the posterior division. So this anterior division joins with the facial vein which I have already formed to form the common facial vein, which actually drains into internal jugular vein. So common facial vein is a tributary of the internal jugular vein. So that is the fate of superficial temporal vein. It joins with the maxillary vein to form retromandibular vein. Its anterior division joins with this facial vein to form common facial vein, which together drains into internal jugular vein. So we can see that supratrochlear, supraorbital and superficial temporal, they are actually draining into internal jugular vein as the common facial vein. Now what happens to the veins behind the auricle? So behind the auricle you have the posterior auricular vein. So what happens to the posterior auricular vein? This posterior auricular vein will be joining, so this is the posterior auricular vein, will be joining with the posterior division of retromandibular vein, and they actually forms the external jugular vein. It is not draining into external jugular vein, but it results in the formation of external jugular vein. That is very important. This is how the external jugular vein is formed. Posterior auricular vein joins with the posterior division of retromandibular vein to form the externojugular vein, and it drains into the subclavian vein. Now, what is left behind? Well, the last one is occipital vein corresponding to the occipital artery, and it usually drains into the suboccipital venous plexus. So, this is about the venous drainage. So, apart from these type of veins, we have two other sets of vein. One is emissary vein and the other one is diploic vein. So, there are mainly two sets of emissary vein. One is the parietal emissary vein and the other one is mastoid emissary vein, which are passing through the parietal and mastoid foramina. And we can see that we have already mentioned in the last session that emissary veins are valvulus veins which connect the veins of the scalp with the dural venous sinuses. So, the parietal emissary veins will be actually passing through the parietal foramina of the parietal bone and will be connected to the superior sagittal sinus. Now coming to the other set, that is the diploic veins within the diplo of the skull bone. We have two sets, one in front, that is the frontal diploic vein, and the one behind you call it as occipital diploic vein. So the frontal diploic vein usually drains into the supraorbital vein, and occipital diploic vein has got two options. It can either pierce into the cranial cavity and drain into the transverse sinus which comes here, or it drains out and joins with the occipital vein. So, these are the two options for the occipital diploic vein. So, these are the three sets of veins. Now, we will move on to the nerve supply. So, we just finished the arterial supply, venous drainage. Now, we are moving on to the nerve supply. So, when we think about the nerves, again, it is very easy to remember. We have the auricle as a demarcating plane, and you have 5 nerves in front and you have 5 nerves behind. So, among the 5 nerves in front, 4 are sensory and 1 is motor. Just like that, among the 5 nerves behind the auricle, 4 are sensory and 1 is motor. And the motor nerve always comes from the facial nerve. That is also very easy to remember. So, first we will see the nerves which are coming in front of the auricle. So, we will start from before backwards. You have the supratrochlear and supraorbital. Just like our arterial branches, supratrochlear and supraorbital, they are actually branches of the frontal division of trigeminal nerve. So, frontal division gives rise to supraorbital and supratrochlear. Then you have the next one, the zygomaticotemporal, that is actually coming from the maxillary division, and the other one is auriculotemporal, which comes from the mandibular division. So, frontal nerves give rise to the supratrochlear and supraorbital, again part of trigeminal nerve. Then zygomaticotemporal comes from the maxillary division of the trigeminal, and the auriculotemporal branch comes from the mandibular division of the trigeminal nerve. So, these are the main sensory nerves coming in front of the auricle, and the motor branch is actually the temporal branch of facial nerve. So, temporal branch of facial nerve actually supplies the frontal belly of occipitofrontalis. That also you have to remember. Now, coming to the nerves which are supplying behind the auricle. So, which are the nerves supplying behind the auricle? So, behind the auricle you have 4 sensory and 1 motor again. So, coming to the sensory part first, you have the great auricular, then you have the lesser occipital, then you have the greater occipital, and you have the third occipital. So, here you can see that great auricular is great, it is not greater. Many of you actually find it, usually commit this as greater auricular. It is not greater, it is just great because there is no lesser auricular. But here you have lesser occipital and greater occipital, because if you say greater, there is another one known as lesser. But here you get only one auricular, that is a great auricular. So, great auricular comes from the C2 and C3 nerves. Then lesser occipital comes from actually C2, greater occipital also comes from C2, and third occipital, as the term implies, it is coming from C3. So, these are the sensory components. Great auricular, lesser occipital, greater occipital and third occipital. Now coming to the motor part is coming from the posterior auricular branch of facial nerve. And what does it supply? It is posteriorly, right? So it supplies the occipital belly of occipitofrontalis. So we can see that the anterior part is actually coming from, the branches are coming from the trigeminal nerve. The frontal nerve, then the maxillary, then the mandibular, and coming to the posterior part, the sensory part is coming from the cervical plexus, especially the C2 and C3. And the motor part, both the division seen in the anterior part and the posterior part, it is coming from the facial nerve. So we can see that there is a great overlap between the dermatomes as well as the cranial nerve, the trigeminal nerve. So what happens is, if you want to do a surgery in the scalp region, it is better to go for general anesthesia, because it's not easy to block a part of the scalp because of the great overlap of the network of nerves. So that also you have to remember. Now just for completion's sake, we will mention about the lymphatics of scalp as well. So the lymphatics of scalp in front of the auricle usually goes to the pre-auricular lymph node in front of the auricle, or the superficial parotid lymph nodes, and the lymphatics behind the auricle usually goes to the post-auricular lymph nodes behind the auricle, or the mastoid lymph nodes. So that's about the arterial supply, venous drainage and the nerve supply of the scalp in a nutshell. Thank you. Thanks for watching.